Hello, this short presentation is going to review how to fill out the new electronic version of our wound care clinician referral form for residential care in Fraser Health. Firstly, you must make sure that you have the latest version of Adobe Reader DC loaded onto your computer, as this is necessary to access, fill out, and send the new electronic wound care referral form. You will likely store the form on your desktop for easy access. And remember, the form requires a password, which happens to be wound care, capital W-O-U-N-D, capital C-A-R-E, with no spaces, each time is open to protect resident privacy. Now let's look at the form starting at the top. At the top where the resident's name is, we'll see a number of red boxes. These are required fields, so you have to fill these out in order to submit the form, anything that's in red. So starting at the top, we have resident's name, personal health number, date of birth, drop-down box for facility that you are sending the consult from, the facility fax number, and this would be the fax number of the neighborhood that the resident lives on, facility contact, so whoever is looking after this resident from a nursing perspective, who we can reach if we need to, the neighborhood, the contact phone number of that neighborhood, as well as extension. When we get to referral, you choose whether it's a first referral or follow-up referral. The date the referral is sent will self-populate, so you don't have to fill that out. Then you will add the title of the person who's sending the referral, whether you're an RN, LPN, or other. Now there is a box for webmail for Skype consult, unless you were part of the virtual wound care Skype project, then don't fill this out. Don't worry about it, just move on. It's not essential for submitting a referral. So getting into wound information, some of it is a required field. As we scroll down, you'll see those red boxes, and that would be type of wound. Again, a drop-down box, which will allow you to pick the type of wound that you are sending a referral about. Location of wound, date of onset, and if unknown, you would check the box unknown. Give a brief history of how it happened. An example would be acute acquired pressure injury, something very short, resident sustained a fall, getting a skin tear, that sort of thing. Any relevant medical history, including diabetes, heart disease, anything that might impact wound healing or the occurrence of the wound. Current Braden scale score, current wound care treatment plan, whatever you're actually doing to the wound right now on a daily or however often you are doing it. With a drop-down yes, no, is physician aware? Is DOC or clinical lead aware? Has this resident or have they recently been treated for wound infection? If they have gone on antibiotics, the latest date for a course of antibiotics, and if a wound swab has been done or not. Now, if the wound happens to be pressure related, you will tick a box at the right of your screen, and it will open up additional drop-down boxes for you to fill out. The first one being the stage of the pressure injury, from stage 1 through to a deep tissue injury. You'll also be asked for, has the Braden scale algorithm been implemented? Yes, no. And there is a link to the algorithm itself, so you can double check the interventions. The type of therapeutic mattress and or wheelchair cushion. This is free text for you to add. Is the wound located on the heel? Yes or no. Is the wound 100% covered in black dry eschar? Yes, no. We also are asking about incontinence. Are they incontinent? If they are incontinent, what is their pattern? Urine, stool, or both? Is this person on a toileting schedule? Yes, no. If it happens to be a lower leg wound, you will check the lower leg wound box, and this will also open up additional drop-down boxes for you to choose from. Now, if there is any pressure component related, you are going to say yes. And an example of this would be, say, rolled up blankets were used to elevate a leg and caused a pressure wound in that area. That's an example. For lower leg edema, yes or no. And we have a drop-down box for how far up the leg the edema goes. Are they wearing compression garments? And if they are, there is a free text box to describe what type of garment and whether or not, and what the level is. Missing digits or limbs, particularly in the with those residents that have diabetes or significant arterial disease. This helps to determine goals of healing. When we're moving further on with the lower leg, we want to know about color, and you'll have a drop-down box with some choices for foot and toes as well. Capillary refill check, they are either less than 3 seconds or greater, so you will choose yes or no. The temperature of the extremities are hot to cold. Can you actually detect pedal pulses? A yes or no. And whether or not, yes or no, there is diabetes. There are multiple choices for the peri-wound skin assessment, and you can choose as many or as few as you wish using the control key on your keyboard. And that can be done for both lower legs. As we move on with sensation, which of course it particularly becomes important with anyone with some neurological damage or diabetes and such, we are going to choose sensation in both the left and the right lower leg, and it gives you a drop-down box with some descriptors. For wound care pain, it is present or not. If they have other pain, it is present or not. And with a pain assessment, these are descriptors of the pain experience the resident is having, and you choose whatever is appropriate for them. If you need more information to be entered that's not captured here, there is a free text box beside describe, and you add whatever you need there to describe the pain of the resident. There is a section or wounds located on the bottom of the foot, yes or no. Have they seen a vascular surgeon, yes or no. And the date, the last date, this means the last date they were actually assessed by that vascular surgeon. And you will be given a calendar to choose the date. We have choices for weight bearing and transfer method, and you choose whatever is appropriate for that person. And descriptors of their most commonly worn current footwear, whether it's slippers, whether it's shoes, or if they have prescription footwear that they are wearing. Lastly, is the wound related to a skin tear or trauma? You choose yes or no, and again, you have a free text box to describe how the injury occurred. Lastly, we have a free text box for additional notes, and this is for any information that you don't feel was captured as part of our electronic form. You add that to the bottom. Now, as we scroll down, we can see we do have an option to attach images. It's a gray box, add image. So to add images, this is what you do is you click on the Add Image button. And what this will do is it'll connect with your desktop and allow you to browse and locate the photo that you want to add. Once you have found it, you highlight it and click Open on the pop-up box, and that will load it onto our electronic form. And if you want to double check that you have successfully uploaded it or check out the image, you'll go to the paperclip on the toolbar at the far left of the form. You click on that paperclip and it will let you view the file attachments or the photos that you have attached. If you've attached an image that you don't want to send, What you need to do at this point is you need to hover and highlight that image that you don't want, and then press the delete key on your keyboard. That is the only way to remove that image at this point in time. So lastly, we're going to submit the form. Now, just to let you know, if you have missed any of the required fields in red, you will get a message when you do press the submit button. So once you click on the submit button, it takes a few seconds, and then an email pop-up box will appear. What you will see is you will see your attached wound care referral form, and at the top you'll see an automatic reply that's going to be sent to your inbox confirming receipt of the referral. You press and click on the send button, and this will electronically send your completed form to us, and we will receive it in our inbox for our wound care referrals. And that is it. That's all you need to do. If you have any concerns, questions, just let us know. Thank you.